My next talk is going to be on packaging and validating the sterilized goods. So we'll be happy to take your questions once I finish the talk, because most of your questions will be answered in this. This is going to be a video based session, because more sterilization is always a dry topic, so I've included a lot of videos to make it interesting. So I'm going to talk about packaging and selecting the appropriate cycle for the loads and validation of the cycle. So I have no financial interest in any of the products I'm going to show you. Before we go into the real topic, it's very important for every management to take care of the staff. There are 10 points of standard of infection control, and we're going to talk about safe care and management of these equipments. Teach your staff, immunize them against the bloodborne diseases, because you're going to handle a lot of sharp instruments. Provide them the adequate PPDs before they handle the sterilization process. So we all know what are the standards of sterilization. Only 1 in a million is allowed to survive, that is 10 to the power of -6. This is the minimum level of sterilization that is required, because it is assumed that any load which is unsterile has 10 to the power of 6 amount of microorganisms. As Dr. Nirmal told you frequently, always follow the manufacturer guidelines when you sterilize the goods, because when you buy a new instrument and if it doesn't work after a few autoclaves, you would definitely see the manufacturer telling you that this is not the right way of manufacturing. As you could see, the simple irrigation aspiration tubing, they have clearly mentioned how it should be packed, how it should be sterilized, and what temperature has to be done. So once you do not follow this, then it's going to be difficult for you to claim your warranty also. So basically there are 3 types of autoclaves. I'm just going to touch upon them, what is needed. Gravity autoclaves, Dr. Nirmal had told you N stands for negative pressure. It's also be called as naked solid instrument, should be only sterilized here, because as you know, in this chamber, the hot air is lighter, it goes up. So it's a displacement autoclave. Vacuum assisted is of 2 types, class S and class B. Simply means, to understand it, class S means it sucks the air out, and B is big in function, and smaller size autoclaves is what calls the B autoclave. So it's very easy for you to keep this mnemonic in mind when you are talking about class S and class B, and there are 2 kinds of temperatures used here. So how do you decide what load you want? First, the most important thing is the water source, because only if you have a proper water source you can get a saturated steam. Remember, the steam should not be hypersaturated or hyposaturated, which could decrease the efficiency of sterilization. So what is saturated steam? 3 to 5% of the moisture. So this will tell you or help you to understand the process. So the phase 1 is preconditioning. So what happens in a class S autoclave is that there's only 1 pulse. So the vacuum pump takes the air only once. But in class B, this spike is multiple times. So the pump works multiple times to take the air out. So this is the basic difference between a S and a B autoclave. Then you have the phase 2 coming up, means the temperature keeps on rising. Then this steam is let into the main chamber, where the time depending upon your load is maintained. That is IUS is high. I saw someone asking about flash sterilization. Flash sterilization is not the terminology used. It is called IUSS, which means immediate use steam sterilization. It has a role in ophthalmology, which I'll be talking about later. Then comes the normal, which we follow 15 minutes at 120 degrees Celsius. So understanding the cycle would also help you to understand what kind of loads needs to be sterilized in these instruments. So this is an important chart. So you have an unsterile load. So ask your question. Green. The blue one means S and the red arrow means no. So does your load contain liquid or not? If it doesn't contain a liquid, the next question you ask, can the air be removed from this load easily? Which means whether you have an hollow instruments or not. And if the air cannot be removed from these instruments, for example, ophthalmic practice has a lot of hollow instruments, then use the pre-vacuum cycle, which is simply the class S or class B, which I told you. If the air can be removed easily, then use a gravity cycle. So the gravity or the vertical autoclave does have a role in ophthalmic practice if you're using only to sterilize naked instruments and your linen. If you're using hollow instrument, please don't use the gravity cycle autoclave. The pre-vacuum cycle is enough. Just for interest sake, in case you have a liquid to be sterilized, because I see a lot of people still autoclaving the RL bottle or the BSS bottle, then ask the question, is the container flexible with residual air inside? If not, does the liquid tend to boil when it is heated? If not, use the liquid cycle. So if the container is flexible with air inside, use the steam air mixture. So what is steam air mixture? Most of the autoclaves have the provision of letting in the normal air from the atmosphere into your autoclave, which is the cycle which is present in most of your autoclave programs. And if it boils over, use the air over pressure, which prevents it from doing it. See, these two protocols are just for interest sake, and if you are going to autoclave fluids, suppose you have a multi-specialty hospital where you use a common autoclave, so these are the questions which you should answer. But if you're a pure standalone eye care hospital, then the top part of your chart holds good, because we don't autoclave any liquids nor your visco. So the type of packing material is very important. The steam autoclave, these are the materials available: paper, plastic, cloth fabric, plastic paper pouches, and wrapped perforated cassettes. All of them work very well, and you can use whatever is convenient to you and available. The fabric, if you're using, there are two types: woven and non-woven. These are two different types of a material or the pattern which is used for weaving. See, so how does this work? When this material or the fabric is exposed to saturated steam, they swell up and they block the air from outside from getting in. So this is the reason why you should never reuse your packaging material, because there are no pores there. So the product inside these paper plastic pouches will still remain unsterile, but the external surface becomes sterile. So never reuse your plastic paper pouches. This is a very important because a lot of places where we go for inspection, they keep on reusing the gowns and the wrapping materials. Non-woven fabric are latest advances. They can be spun bound, heat bound, or belt bound. All are equally effective. Tyvek is another material where you could see the water droplets rolling down them. Spun bounded material made up of high ethylene polypropylene. ETO has a different packing material. Ensure that the proper packing material is used for these ETO. This tabular column gives you an idea of what is needed. For steam, polythene is not essential, and for plasma, only polyethylene is needed. So use the proper material and know what autoclave you are having, and use the proper packing material accordingly. So styrofoam trays are very, very effective. The only thing you have to follow is have adequate space. Don't pack these trays with a lot of instruments, because you're going to allow steam to penetrate. Use a class 5 integrator in every tray. If you have 10 cases, always have 10 instrument sets and put in a class 5 into each tray. Don't have a single tray and each time open up and take these instruments for all these 10 cases. It's always good to have 10 trays for 10 cases or so. Sealing them is very important. There's a medical grade sealant, and the sealant thickness is around 3 to 5 millimeters, which ensure that the product insides are always sterile. So if you're going to use a wrapping material, there are different types of technique used to wrap: the box technique or the envelope technique. You can use whatever you want to. All are quite effective. The main process is to ensure that the product inside remains sterile, and when it is opened by a third person, it continues to remain sterile, and they're able to open it, and the assistant is taken in a sterile manner. Nowadays, pre-fabricated stickers are available, which is very easy for us to pack. As I told you, gowns are made up of these disposal materials should not be reused, but I'm just telling you how to fold a linen gown in case you're going to reuse it. Ensure that the linen is sterile, it has reached your sensitive area after proper protocol. And because a lot of time we see that even the one which we get as disposal, they're not folded in the proper way. The surgeon has to find the head end and the tail end, and you'd find that the gown touching all the table and everywhere around. So this video tells you how a linen has to be folded, just to follow the no-touch technique. So when you're going to unwrap this gown, the surgeon could be easily gown this without touching the unsterile areas. So this particular disposable gown is just used for a demonstration purpose. So this is how it should be folded. So once you're going to unfold it and wear it. It's going to be very easy. With the no touch technique, the inside of the thing remains unsterile and the outside still remains sterile. Yes. So this normally with the latest techniques, a bin should never be used to sterile to autoclave instruments, but it can be used to autoclave linen. Here you could see the paramedical staff really putting in a lot of linen into the sterile. This should not be done. You should allow adequate space for the steam to penetrate all throughout. And in case you're using your bin to sterilize your instrument, make sure they are kept inside the bin unpacked. This is a very important point which you should keep. Otherwise, just use your bin to sterilize your linen load if you're still using your linen for your surgeries. So as I told you, this is a newer term for flash sterilization. It's called immediate use steam sterilization. They have a role in ophthalmology. The temperature used for this is 131 degrees Celsius for 5 minutes. There's a rapid increase in temperature. So it's used only for emergency use. For example, if you have an IOL cutter or any other instrument which is rarely used, then and if it falls down and becomes unsterile, then this can be used. Hence, this instrument has to be kept inside. Unpacked. You should never pack these instruments, and they have to be used immediately. They cannot be stored for use, and hence because they cannot be packed, this instrument has to be kept in the sterile area or inside your theatre. And this form of sterilization should not be used as a routine and only for emergency purpose. So next part is validation. So what is validation and why is validation needed? This is a textbook definition of validation, but to simply mean that the lot of processes in manufacturing, by just looking at the product, we would never able to say that the process of sterilization has been done. For example, if you see an instrument, can you just say that this instrument is sterile or not? We cannot. So for this purpose, we have a lot of validation devices. For example, why are you keeping the temperature at 21 degrees Celsius and for 21 minutes? So this is basically called validation. And monitoring is means that a physical checking of all the parameters of temperature and pressure, and verification is also very important, and the most important part of verification is the biological indicator. So validation, monitoring and a verification is an important part of a sterilization process, which could keep you away from the medical legal cases in case there's a sterilization failure and the patient ends up with an endophthalmitis. So validation consists of three parts: installation qualification, which is supplied to you by the manufacturer, operation qualification and a performance qualification. So the three parameters. So what is installation qualification means? Once the manufacturer sets up the autoclave in your place, he has to give you a calibration certificate showing that the machine is working well. The operation qualification is for you to check physically and manually all the pressure gauge and the valves, and the performance qualification is all the value indicators, which I'll be talking about subsequently. So performance qualifications of two types: physical monitoring and the biological activator. So this is a certificate which will be provided by the manufacturer to you when you buy the autoclave. Please ensure that the date and sign, everything are accurate before you take the autoclave into your notice. So there are different types of autoclave indicators, and this comes among the performance indicator, which I'll be talking about later. The biological indicator, the spores has to be used is Bacillus turcothermophilus, because this is the most resistant one. As I told you, why 121 degrees Celsius is used, because only at 121 degrees Celsius, the spores of the Bacillus turcothermophilus are completely destroyed. So this is the reason why 121 degrees Celsius and 15 minutes is used, because that is the time needed to kill the most heat resistant spores in your autoclave cycle. So when is a biological test indicated? This is very important: during installation, relocation, after a malfunction, after you repair your autoclave, and the event of a sterilization failure. So what should you do before you start doing your autoclave? That is, if you buy a new autoclave or if it has failed and it's come back to you, 3 consecutive negative tests of biological indicator with a class 5 integrator and a sterilization printout are all needed before you commission your autoclave. This is very important. So now let's see what are the indicators that should be used. Suppose if you want to just sterilize your routine loads, that is linen, and for surgical instrument, the first 2 columns are the same. That is a physical parameter monitoring and a class 1 tape is stuck outside. For a linen load, any one of these 5 is more than important. But if you're using a surgical instruments and an implant, then you need to have a biological indicator and a class 5 for every load. You have to monitor the efficacy of the sterilizer. So the first one is for your load. The second one is to monitor that the sterilizer is functioning well. So this should be done in an empty chamber if it is a class S or a class N, and an IUS autoclave, and a loaded chamber if it is a gravity based autoclave. And this is, as I told you earlier, during an installation, relocation and malfunction, these are the parameters which has to be followed. So summarizing, there are commissioning and performance qualification indicators which has to be followed before you take up the indicators. So this is a small video which basically tells you how you really have to do all these indicators. I'm not going to talk about how these instruments are cleaned, that is beyond the scope of this topic. So once the instruments are cleaned and they are packed individually in different sets depending on the number of cases you have. Always use a medical grade sealant because the sealant is around 3 to 5 millimeters, and ensure that a class 5 integrator is placed in every set. And always use the plastic paper pouches and ensure that an adequate space available around each tray for the steam to penetrate inside, as shown by this paramedical staff. And ensure you place the autoclave in a vertical orientation, never in a horizontal orientation, because only this allows steam to go through. Biological indicator is the most important one. Always have 2 vials of the BI for every cycle. One should be packed the same way you pack your instruments because it follows the same process, and the other is kept outside as a control. You can also place them in your linen load or the instrument load just to ensure that everything goes on well. The Bowidic test usually is helpful only for a vacuum pump autoclave. It ensures that the air has been completely removed from the autoclave. It should be done only on an empty cycle. An empty chamber. You have to keep it in between vertical loads of linen. Place it in the most demanding part of the autoclave, which is usually the exit or the entry. This is a double door autoclave. You need not run the entire cycle, just the 121 degrees Celsius for 15 minutes, and then you can open it immediately. Okay, have a visual check to ensure that the paper has completely changed, and only then pack your instruments. Ideally, according to American standards, a Bowidic test should be run after every cycle, or at least at the beginning of the day. The Bowidic also comes in strips. If you're using smaller autoclaves, you can use the strips. So this is an troubleshooting sheet which Dr. Niranjan will be talking to you about suppose if your Bowidic doesn't change, what are the parameters which you have to look into. Dr. Niranjan, the next stop is basically on troubleshooting the failures. So I'm going to skip this slide. The next one is the class 6 autoclave, which is otherwise called the PCD, that is known as the process challenge device. So what is the process we're going to challenge? That is the ability of the autoclave to make the steam go inside a hollow tube, because we do have tubings, right? So this is a 1 meter long tube, is available in silicon or stainless steel. The strip is folded as shown here. The way you insert the strip inside the holder is very important. So this basically works on the principle that your autoclave is able to remove the air inside this 1 meter, 0.1 millimeter lumen tube, and then the steam is able to reach the other end of the holder. So this is also again packed the same way you pack your instruments and placed along with your sterilizing goods or your instruments. It can be also placed inside linen if you're going to use the gravity based autoclave. So always having a horizontal double door autoclave makes a lot of sense, because you can directly open this at the other end into the sterile area, and you can directly go into the operation theatre. Troubleshooting device or a strip or a thing that you can stick it in your CSD area and teach the staff of how to troubleshoot a failed PCD test. So pre-vacuum autoclave, porous use the Bowidic test, hollow instrument use the PCD. So once the autoclave is open, always teach your paramedical staff to first inspect all the indicators to ensure that the proper color change has happened. So here you could see the paramedical staff visually inspecting all the validating indicators. As a surgeon, it is your duty to always have a look at all these indicators before you start your surgery, because if the staff education is not proper, then they could miss a failure. So always again follow the manufacturer guidelines telling you what is a clear-cut, a positive test and not. The biological indicator is very important. As I told you earlier, one is kept outside and the other is it's processed inside the sterilizer. Once this is coming out, to understand the biological indicator, it consists of two tubes. The outer one is a silicone tube and the inner one is a glass tube which has a broth inside. So break the glass tube so that the indicator and the broth are mixed, and this is incubated at a biological indicator incubator which is easily available and not very expensive. It is incubated at 57 degrees Celsius for 48 hours. And it is based on the fact that the violet is kept outside, the bacillus has not been deactivated. So after 48 hours, you'll find that it has grown and the color changes to yellow, whereas the one which is kept inside doesn't change color because the bacillus has been killed. So this is the basic, and the biological indicator is the most important indicator which would help you to prove that your indicator or your load is sterile. Then whatever said and done, make sure you have a proper validating and a recording technique where all the indicators are stuck on the tubes. So steam does has disadvantages because it cannot sterilize all this. For this what we use your ETO and your plasma indicators. And ETO, as I told you, has a different validation sticker, so don't use your steam validation stickers for your ETO. So shelf life of sterilized goods is a very hot question everywhere, and to understand this you have to understand Newton's law of motion, which says that every object continues to be in a state of motion or rest unless an external force acts on it. Similarly, every sterile good continues to remain sterile unless it is being disturbed by any one of these factors. The quality of the paper goes off if your storage area is not good, the storage condition is not good, for example the temperature, pressure and the relative humidity is not maintained, conditions during transport and the amount of handling. So hospitals can follow their own protocols of how long they have to maintain a sterile goods. So there is no clear-cut dictum, and a lot of studies which have found that the goods have continued to be sterile even after 16 months. So it all depends upon the wrapping material and your storage area. Thank you.